Hello, everybody. I'm Dr. Pracha Eamranond, Chief Medical Officer at Doctorpedia, and today I have the pleasure of presenting Dr. Adam Boruchov, Chief of Hematology and Oncology at Smilow Cancer Hospital at St. Francis, affiliated with Yale in Hartford, Connecticut. So, Dr. Boruchov and I go a long way back. We've worked in multiple settings, so it's absolutely fabulous for me to be sitting here talking with him today. Dr. Boruchov has been managing teams of cancer specialists throughout the Northeast, and we're proud to have him here and provide his expertise, particularly during these difficult times with the pandemic. And I certainly have been seeing lots of cancer patients as well, and we're here to see how Dr. Boruchov has really approached cancer care during the pandemic. So, Dr. Boruchov, welcome.
Thanks for having me.
So, can you start off by telling us a little bit about yourself and how you got into the role that you're in?
Sure. So I started my career as a basic scientist studying immunology at Sloan-Kettering, and I came here to Connecticut in 2008, and I took a more clinical role focusing on clinical care and clinical research. And right now I focus on treating patients with blood cancers, leukemia, lymphoma, multiple myeloma. Over the course of time, I was head of research, and now I've become Chief of Hematology and Oncology at St. Francis and service line leader for the region of Trinity Health of New England.
Great. Thank you so much for the background. Now, let's cut right to the chase. So for all of us, as patients, physicians, healthcare systems, we've been dealing with the pandemic in different ways. Clearly, we've had to rework how we manage patients, particularly with COVID. But there's also been, in multiple webcasts that we've done, we've talked about how cancer, we're seeing it in a different light with patients coming in now, not having been screened for cancer, coming in with late-stage cancer. Can you tell us about your experience with cancer and the pandemic?
So, first off, in terms of the Cancer Center for our own pre-existing patients, we had to do everything we could to make that a safe place. So patients were coming in for therapies, and we had to make sure that they would not, number one, transmit the virus from themselves or their family members to our staff and then back to other patients. And we had to make sure that we were not transmitting the virus, COVID, from the staff or other patients to the patients. So it was we had a very active system of limiting contact and limiting the spread of the virus. So first thing we did was we limited the number of visitors. We had adopted social distancing way before they were officially in place, and we also did a lot of pre-visit phone calls, screening for any kind of symptoms. The other things that we did were we had a lot of our patients come from extended care facilities. So a lot of patients are getting therapy while they're at a skilled nursing facility or something like that. As those became hotspots, we had to really limit those patients coming into the cancer center or figure out a way to work with them because we couldn't exclude them. They're still our patients. So we had a very low threshold to treat patients as PUIs, as patients under investigation. And we had to develop separate safe rooms where we could bring in those PUIs and still be able to treat them. So it was a very dynamic system that was in place as we got our patients in. Then we also thought about, okay, we've got a patient who's coming on a regular schedule for their chemotherapy. We know there's some level of risk when they do come in. How do we limit that? So another adaptation that we did was we changed the dosing and frequency. So instead of giving a certain drug, say every 2 weeks, sometimes we would give a higher dose of it and spread it out to every 3 weeks or every 4 weeks. This way that they would have less exposures, less visits to the cancer center, less chance to contract the virus. That was another effort that we did. In terms of patients coming in, newly diagnosed patients, we certainly are seeing that patients are not going as much for their mammograms, they're not going for their colonoscopies, and unfortunately they're not seeing their PCPs. And we're seeing that the diagnosis of particularly early stage diseases is dropping.
So So right, I mean, you've raised a lot of issues. Patients with cancer are coming in various stages, and you've been managing them differently than how we have been managing in the past. So we're learning all the time from this. I wanted to just ask you, because I've had patients, my own patients who I've known for years, and those who have just come in and who have passed. It's been a very traumatic experience, I think, for a lot of us. Not being able to see our loved ones, and it's not just COVID, right? It's a lot of times it's cancer related. So how has this impacted you personally?
Oh, it's been awful. I mean, to watch patients come in alone. So we always tell patients when they come in for a new diagnosis, bring a loved one, bring someone support. You know, that one of the best ways that we predict how someone's going to do is what does their support system look like? And we always ask them to bring their support system in, whether it be a spouse or a family member or a friend or something like that, clergy, whatever, bring them in. And so to have these patients come in and be alone, it's terrible to watch this. And then, you know, you can see them, you're talking about a diagnosis of cancer, you're talking about chemotherapy, and you know, oftentimes patients don't hear a word you're saying, but you're relying on the caregiver. The caregiver's not here. And so it's been really challenging. Certainly, I've had a couple of patients who have passed away in the hospital completely alone, all by themselves. It is devastating. I've talked to surviving family members afterwards, and they say the worst thing about it was just not being able to speak to them. So it's been really challenging.
Right. You know, and for many people don't know, but I've walked through your hospital many times, and it's an amazing experience. You know, I think we're about to publish a paper actually on the amazing patient experience and the scores related to patient experience from the hospital that you worked in, that I've worked in. And, you know, it's a totally different experience. We were never set up to really deal with dying and death within the hospital system without these support systems involved, you know, and certainly digital technologies have been helping to a certain extent to connect, but certainly doesn't replace, you know, human contact and the closeness that you have when at the end of life, you know.
Yeah, and I'll tell you, so much of the burden of that has fallen on the nurses in the hospital and even in the cancer center. The nurses, you know, are the unsung heroes of this pandemic. I mean, you know, when patients are passing in the hospital, or they're trying to connect with their loved ones by a phone or a FaceTime or something like that, it's the nurses who are there, the nurses who are holding their hands, and we say they're not alone, they're with the nurses. But, you know, there's a lot to that. There's a lot of wear and tear on the nurses. I mean, we've seen it even in the cancer center. When they are alone, the nurses are there. They're holding their hands. They're the ones, you know, getting them through this.
Right. A shout out to all the nurses out there. I think Dr. Boruchov and I share that same you know, appreciation for our nursing staff that have really carried us through this, you know. So can you just give us, what is your top lesson to all the viewers out there that you've learned from the pandemic?
Well, you know, people are strong. Families are strong. You know, we get through things, but what's still going on is that you know, we're in a different place now. People are getting vaccinated. Numbers are going down, so it is safer. And people are still not coming in for their screening tests. You know, cancer treatment. People say, "Is cancer ever going to get cured?" We do cure cancers quite often when it's diagnosed at a very early stage, because screening works. Mammograms, colonoscopies, screening lung cancer, CAT scan, they work. They work because they diagnose it at an early stage. You can cut it out and get rid of it. Unfortunately, because of the pandemic, we're seeing a huge drop-off in mammograms, colonoscopies, just routine visits to the PCP, digital rectal exams, PSA checks, all of this stuff. And so the cancers aren't diagnosed at an early stage. We know the cancers are still there, but they're going to be coming in at a later stage, which is unfortunately less curable.
Right. And we were commenting on this earlier. We've been spending the last few webcasts across the Atlantic in the UK, and they've commented as well. I mean, patients are just coming in, not getting screened. And so I hope our audience really listens to that. I have been challenged myself, you know, with my own patients during the pandemic of getting them screened. And I hope they'll be proactive in moving forward with screening for various types of cancer. I will say, there is a sad story I have to tell where one of my neighbors recently passed away from cancer, and it's been a tragic experience for our neighborhood. And dealing with this during the pandemic, we have a mental health campaign that we've launched through Doctorpedia, and we hope we can be a source of support, because everyone is going through a lot of stress, and the strain on our healthcare systems is just unbelievable right now. Even in well-funded systems like ours, where we have good access to mental health, I think in combination with cancer, it's been really tough. So I look forward to coming out of this. I hope our audience will listen and really be as proactive as possible in terms of cancer screening. Any last words before we adjourn, Adam?
Get vaccinated, get vaccinated. The vaccines are there. Unfortunately, not everyone is taking them. I mean, we talk to our cancer patients. That's a big question. Can I get vaccinated? The answer is always yes. There's almost no one that we say hold off on, because although we understand that the vaccine response, the immune response, might not be as good for someone who's on chemotherapy, we know that it's still better than not getting the vaccine at all. So will everybody have the same level of vaccine if not getting chemo? Probably not, but it's still better than nothing. And hopefully later, when we can have the ability to test for responses, there may be booster vaccines, there may be another round of vaccines. We all are assuming that we'll be getting vaccines at least once a year, just like we do for flu shots. So really come back to the system, get your vaccines, get your screening tests. We've come a long way, and we've got a long way to go.
All right, Adam, thank you so much. It's a great point. I think a lot of us have been struggling with making sure that our loved ones, our patients, our friends are getting vaccinated. There's still a lot of resistance out there, so thank you for making that point. And please get vaccinated, everyone. Thank you, Dr. Adam Boruchov, my friend and colleague. It's been a pleasure to talk to you. And thank you, everyone, for joining us on Doctors on the Front Lines COVID-19 webcast.